everyone. I'm Dr. Brenna Meyer at Optimal Physical Therapy, here with Tiffany, one of our physical therapist assistants, who's expecting a little bundle of joy. And we're gonna go through some prenatal stretching and mobility exercises that are safe for all stages of pregnancy. So we'll start on hands and knees. Go ahead and get on your hands and knees. The first one we're gonna go through is called cat-cow. It's a common yoga pose if you're familiar, but it's a really nice one to stretch out the spine. So to start, go ahead and arch your back up towards the ceiling and look down. Good. So you want to think about all the way from your head all the way to your bottom, rounding, and then arch down and let baby fall down towards the table and then look up towards the ceiling. Good. So you're trying to go all the way one way, all the way the other. Now, if one direction is a little bit uncomfortable, you don't have to go all the way. You'll just have to kind of listen to your body. And then go ahead and go up, good, and back down. Good, so holding for a few seconds in each position is great. And just listening to your body on what feels good and maybe what doesn't, and kind of holding back on that position. Good. Okay, the next one we're gonna do is called child's pose. So you're gonna bring your knees a little bit further apart than your ankles are, so you have room for baby. As you go back down, you're gonna bring your butt towards your heels, and then let your kind of rest of your body lean as much as you can forward. This is one that's gonna change through pregnancy. You're not gonna be able to get down as far as you're further along in your pregnancy, and just listening to your body. You could also put a pillow underneath between your thigh and your shin here to support a little bit if you need to, but just hanging here and taking some deep breaths, thinking about breathing in and out. And this is a good one to hold for about a minute or so, just breathing into it. And then one variation is you can bring your hands, go ahead and bring both your hands to the right side, good, to stretch the left side a little bit more. So this one, same thing, just breathing into it, holding a nice big stretch in your side. And then go ahead and repeat to the other side. Bring those hands to the left. Great. To stretch the right side. Perfect. Good. Okay, the next one we're going to do, you'll be laying on your side. We'll do it on both sides, so it doesn't matter which side you start on. You're laying on your side with your arms kind of out on top of each other. And then you're gonna keep your hips and knees where they are and rotate the top arm up towards the ceiling and then towards the wall or towards the other side. Thinking about stretching and rotating your whole trunk over and then coming back. So this is a really great one for the rib cage. The rib cage can get really stiff and stuck during pregnancy. And so this is a nice one to improve the mobility of your rib cage. Very nice. And so this one I would say, I usually say maybe do 5 on one side, and then she would switch to the other side and do the same setup, just coming back the other way. Okay, the next one we're gonna do is a stretch for the calves. The calves can get really tight. A lot of times people can describe cramping that happens in their calves. So this is a great one to do before bed to hopefully prevent some of that. So she's gonna put her hands up against the wall just to have some support, and then bring one leg back. Good, she's gonna keep her heel down and her toe down and just kind of lean as much forward as she needs to feel a nice stretch along the calf here. This is one where you'd hold for a good 30 to 60 seconds on each side. Good, so go ahead and just try it on the other side too. And then she would just bring that foot back, heel stays down, toes are down, and then leaning forward until she feels a stretch in that calf. Okay, the last stretch we're going to do is to stretch the forearms and kind of the wrists. Carpal tunnel can be really common during pregnancy because of all the extra blood flow that our bodies have when we're pregnant. And so this is a really nice stretch to stretch that out and hopefully prevent some of that from happening. So she's just going to place her hands on the table, put a little bit of pressure on them, and then just lean forward until you feel a stretch through there. And this is a little bit of a kind of back and forth. So stretching and then backing off. You can kind of go back and forth, maybe 12 to 15 times, back and forth to stretch that forearm and get that nerve moving well through the wrist and forearm. Hello everyone, I'm Dr. Brenna here at Optimal Physical Therapy, and I'm the pelvic health specialist here. We're going through some prenatal exercises. Today we're going to go through some prenatal core exercises. These exercises are safe for all stages of pregnancy, so we'll get started. So I'm going to have you get on your hands and knees. This is Tiffany, by the way. She's our physical therapist assistant, and she's expecting her first little one, so she's going to be our model today. So this one is called Bird Dog. This is going to be a core exercise, getting the core muscles. So the first step with all these exercises is to basically give your belly a little lift, give your baby a little lift. Lift that baby up, hold that, and then she's going to lift just her arms up, one arm at a time, up and back down. So this would be level one. This is the easiest one of this, just to lift those arms up and down, keeping that baby nice and hugged close to you, pulling those tummy muscles in. The next phase would be to leave the arms down and just to kick the legs, alternating them back, good, and forth. Keeping that baby tucked in, perfect. That tummy muscle on. And if you're feeling so inclined that you can feel like these are easier, you can put them both together. So then she would do opposite arm and opposite leg with that tummy pulled in. Take it nice and slow and controlled. If you ever feel off balance, put a hand or leg down. But this is a great way to have our core muscles working in a safe position. Okay, the next one we're going to do is called a Clam Shell, and this one is going to work a little bit more of your hip muscles, but also your core. Your hip is really part of your core, and so when we're talking core, we think all the muscles that go around here that are going to help support baby as you grow. So you're going to be on your side. You're going to keep your feet together, but just lift your knee up in the air. So go ahead and lift just a couple of inches up towards my hand. Good. And back down. So see how as she lifts, she's not rolling backwards. She's lifting up, keeping it nice and controlled on the way back down. Good. So you can repeat this maybe 12 to 15 times on each side. Okay, the last exercise we're going to do today for core strengthening, prenatal core strengthening, is the side plank. So this is a modified side plank, so it's a little bit safer for when you're pregnant. So she's on her forearm there, her elbow's on the ground, and her forearm is there, and then the knees are stacked together, and then feet are kind of behind her body here. So that gives you a lot more stability. And then she's going to pop up onto her elbow and her knees. Good, and this could be even just for a couple of seconds if that's all you can hold to start, or it could be holding for maybe 10 to 15 seconds and kind of taking deep breaths and really giving baby a little hug with your tummy muscles. Perfect.